the centre's liberal vaccine policy. Is it actually liberal? Is it just a false promise? My colleague Arvind Gunasekar has accessed documents that reveal the centre's doublespeak. NDTV has in its possession the centre's letter that it's written to the Delhi government. Now, the centre has told the Delhi government that 92,000 doses of Covaxin and 3 lakh doses of Covishield are available for direct procurement for June. The centre's letter to the Delhi government essentially uncovers the truth about the liberal scheme that the centre actually fixes quotas of how much vaccine Delhi can directly buy. Why is the centre fixing quotas of states' direct purchases? Is this really the centre's liberal scheme? Because if the scheme is liberal, then why is the centre fixing quotas of how many vaccines the states can directly purchase? After claiming free markets, the centre here is seen, in this letter written to the Delhi government at least, determining the vaccine quota for Delhi. The big question, therefore, that we're asking is what's liberal about this vaccine policy if the centre is going to be governing the quotas that states can procure on their own? Is this really a false promise then that's been made? Because the documents reveal that there is doublespeak on the part of the government, which on the one hand says this is a liberal policy and on the other hand is in fact governing the quota. Arvind joins us with the very latest. Arvind, what more can you tell us about the centre's letter to the Delhi government and how does this expose the centre's doublespeak on the vaccine policy?
Rishika, if you could remember, on April 21st, the central government released the new vaccination policy, called it as liberalized pricing vaccine policy with effect from May 1st, covering the age group of 18 to 44. In that particular liberalized vaccination policy, the centre had said that the state governments can directly procure vaccines from the domestic manufacturer. According to this particular new policy, the 50% of the domestic production has to be given to the central government and the remaining 50% can be directly procured by the state governments and also the private hospitals. So this is the new policy that is in effect across the country since May 1st, and the state governments can directly procure vaccines from both Bharat Biotech and also Serum Institute for vaccinating the age group of 18 to 44. So after this particular policy that came into effect, several state governments made the purchase orders with both the companies, and as per the centre's directive, all the state governments, when they make the purchase order, they have to make the payment in advance. So almost all the state governments with their purchase orders have also made their payment in advance. But what we are being told by now with several state governments is that it is the central government, despite the state governments making the purchase order, making the payment from their end, it is the central government which is still dictating the allocation order. That's what we are getting to hear from several state governments. In fact, we have also got 2 letters that were written by the Union Health Ministry to the Delhi government on this allocation. In fact, in this particular letter, the central government says that the allocation for the June month, that is for the both Covaxin and also Covishield. If you could take the Covaxin, the allocation for the Covaxin for the state of Delhi for the age group of 18 to 44, that is the vaccine that have been directly procured by the state government of Delhi, is just 92,000, and whereas the Covishield is somewhere over 3 lakh doses. So that's the allocation that has been made by the central government, not just the Delhi. In fact, we have also accessed the affidavit that was filed by the central government relating to the vaccination policy in state of Kerala. Even there, the centre has said that they have already given some 1 lakh doses for the state of Kerala between the mid of May. So that the centre is arguing, saying that though the state governments have been allowed to directly procure the vaccines from the manufacturers for the vaccination of the age group of 18 to 44, but it is the central government which is allocating this particular vaccines on the pro rata basis based on the state-wise population. So that's where the state governments are saying that if we are making the payment from our own budget, then why is the central government involving here, and why is the central government dictating the monthly wise allocation? If the policy is liberalized policy stating that the state governments can procure directly, then why is the central government involving here? So that's a question that the many state governments are raising. In fact, we also reached out to our sources in the health ministry, but we have not got any response on this front.
All right, very interesting. On the one hand, while the centre claims that this is part of a liberalized vaccine policy, on the other hand, the centre is determining the quota for vaccine for states after claiming that it's a free market. So that's clearly doublespeak. We are going to await answers from the government on what really is their thinking and their rationale behind this. Meanwhile, let's also get you an update from Delhi. This is what the Delhi Chief Minister had to say about the vaccine policy.
जब दुनिया के दूसरे देश अपने अपने लोगों को बड़े स्तर पे वैक्सीन लगा रहे थे, हम अपने लोगों की वैक्सीन लगाने की बजाय अपनी वैक्सीन दुनिया के दूसरे देशों को भेज रहे थे। अगर अपने देश के लोगों को सही समय पे वैक्सीन लगा दी जाती तो शायद दूसरी वेव के प्रकोप को काफी कम किया जा सकता था, कई लोगों की जान बचाई जा सकती थी। उन वैक्सीन को छोड़ दीजिए जो केंद्र सरकार ने दिए हैं, उन्हें छोड़ के कोई भी राज्य अपने प्रयासों से किसी भी कंपनी से एक भी एक्स्ट्रा टीके का इंतजाम नहीं कर पाया। वैक्सीन कंपनियों ने साफ साफ कह दिया कि वे राज्य सरकारों से बात नहीं करेंगे, केवल केंद्र सरकार से बात करेंगे।
All right, we have with us PKD Nambiar, political analyst whose views lean towards the BJP. We also have Raghav Chadha joining us, MLA and spokesperson of the Aam Aadmi Party. Thank you both very much for being with us. Mr. Nambiar, if I can begin by asking you, what really is the thinking, the rationale behind the government's vaccine policy, if at all there is one, because it appears to be very chaotic at the moment, and what we're seeing on the ground is just an acute shortage, not just being reported here in Delhi, but everywhere in the country.
Ritika, the challenge in Indian, the problem nowadays, what we see it in all the channels or all the discussion is that we immediately just jump and start comparing. India is driving the world's largest vaccination drive, and which is also going to be the first time in the world that the universal vaccination. We have, as we speak, I believe that we have, as per the government data, more than 22 crore people have been vaccinated. Yesterday, I was talking to a very senior doctor in the US who happened to be a client of mine. He said even in the US, despite everybody's like Kejriwalji and etc. is saying they are all stocked the vaccines for themselves for even the next generation, but even they have not been able to do more than 60% of the population even today. Whereas the people can just drive anywhere and get a vaccination with 33 crore people. So I think we are creating some kind of a panic. Some leaders, like including like a Kejriwalji or some other people, they just wanted to create a panic among the people. We have to understand it is not like a bread jam that any company can go and start making the vaccine. Tomorrow morning, Raghav Chadha or PKD Nambiar cannot go and start a factory in Okhla and start making vaccine. These are evolving situations, evolving technology, evolving stuff, and the government also is acting according to the evolving situation.
Okay.
The same people, the people who are now talking about the vaccination, if you could remember in the January 19th, if I remember that when the vaccination drive has started in India, a large number of opposition leaders were talking about the safety. They were even doing messages and tweeting and saying that is these vaccines are right? Are they safe? They have created a question, and you remember that.
No, I think we're past the stage. I think Mr. Nambiar, we can safely say that we're past the stage of vaccine hesitancy in a certain sense. There was, I agree with you, hesitancy when we started out, but I think now that hesitancy has, I can safely say, translated into a desperation. I mean, you're saying that anybody can drive in anywhere and get a vaccine, but I can tell you from personal experience, it was not quite that easy for the 18 to 44 age group to get appointments and get vaccinated. But that aside, respond, Raghav Chadha, respond. Let me get Raghav Chadha to respond to you. Respond to what PKD Nambiar says. He says that, if you look at the absolute numbers, what we've achieved is absolutely stellar.
Look, first of all, the vaccination policy of the government of India, quite frankly, appears to be a joke, simply because state after state is running out of vaccines. And as far as the government of India's decision making is concerned, it appears to be nothing but a summation of knee-jerk reactions. India, despite being a global manufacturer of vaccine, despite being the vaccine laboratory of the world, was hell-bent on exporting vaccines and garnering global goodwill for the Prime Minister and boosting his image rather than inoculating its own citizens. And when this second wave hit us, what the government of India should have done is A, ramp up the production of the domestic manufacturers. Number two, invoke compulsory licensing and let other pharmaceutical giants in this country who can produce these vaccines in safe environment also produce these vaccines. Number three, the government of India should have gone overseas as a single agency to procure vaccines from Pfizer, Moderna, Johnson & Johnson, so on and so forth. And lastly, the government of India should have immediately given approval to Pfizer, Moderna, etc. in India, and their regulatory compliances should have been met. Now, what a situation that we have in this country now is that Pfizer wishes to sell in India, Moderna wish to sell in India, but the government of India has not even given them regulatory compliance certificates. Number two, every state government of this country has been let alone. They have been said to look after their own selves, fend for themselves, and they have been said in no uncertain terms that you float global tenders, go to the international market and procure the previously exported vaccines on your own. Now, the problem, Rishika, is that when a state of India, or when India has 36 different units, that is 28 states and 8 union territories, that is 36 enterprises, goes to the international market to procure these vaccines.
Yes.
We merely not only compete with ourselves, but also compete with developed nations who will be bidding against us. And every manufacturer has said this to the Indian states in no uncertain terms, that we will deal only and only with the federal government. So they will not even deal with the state government.
Respond to what Raghav Chadha is saying. I mean, how can we be bidding for global vaccines? You know, despite being the pharmacy of the world, we are currently at the mercy of a lot of foreign manufacturers to supply vaccines to us in order to be able to inoculate our population and do it quickly. Time, remember, is of the essence in this story. You know, what do you make of this fragmented procurement policy? Do you think this is the best move that the government had? Or do you think it's just convenient at the moment for the government to just leave it to the states?
In fact, I'm so happy that we are living in 21st century, a world of technology, wherein everything what you and me speak is recorded. Please recall in your own library, even maybe, I don't know whether it is Raghav Chadha or Kejriwalji or anybody, or for that matter, the Congress and the other many chief ministers, even as a part of their election speeches, they were offering free vaccines, and they were saying that please allow us, we would like to go and buy it. We wanted to vaccinate all our people. This is not a decision of the central government. It was basically came from multiple chief ministers.
No, but that's exactly the point. That's exactly the point. Irrespective of whatever the states may have said, and I will get Raghav Chadha to respond to you, is it not the responsibility of the central government to procure vaccines for the country? You have a Punjab fighting with the Karnataka, fighting with the Delhi in front of Pfizer today for vaccines. Is that the best strategy?
No.
Not just that, Punjab is fighting with Hungary.
You again missed it.
Delhi is fighting with the US.
I think we are just, there are multiple things which we are actually putting it in this frame. One, the so-called export.
My question is very simple, Mr. Nambiar. It's a very complex story. But the aspect that I'm asking you about is very simple. Do you believe that the best strategy that the centre could employ was this fragmented approach to have each state bat for its own needs with global pharmaceutical companies? Very simple question.
No, it's very simple. Of course, it is very simple. If a state believes that they can, and they have the power and they can buy and inoculate the vaccines given to every citizen of their state, why not? Why not? Today we are talking about the Indian companies, only 2. There are many companies.
States are saying that they're not being able to do it. We've heard from state chief ministers time and time again saying we're not being able to do it. You have your own BJP government state chief ministers who've come out and said that this bidding process, global tenders are futile.
Because it's only just few. Like you will find only a Kejriwal, people comes up every day. They are fascinated for the press conference and creating a political story out of it. Vaccination should be required for every individual in this country, and the government of India is working towards it.
I have to give Raghav Chadha the last word. Raghav, how is this going to play out? How is this going to play out? And very quickly, Raghav, I want you to also comment on this double speak as far as the policy is concerned, where on the one hand, the government says we've given states a free hand and that's what you asked for. On the other hand, there is a letter that the centre has written to the Delhi government determining the quota for June.
Yes. So, first of all, I will respond to the question that you've asked first. As far as domestic purchases of these vaccines is concerned, the states simply do not have a free hand because these domestic manufacturers, that is Bharat Biotech and Serum Institute, have conveyed to states in no uncertain terms that what allocation will be made to your state will be determined by the central government. In fact, the chairperson of Bharat Biotech, Mr. Ella Krishna, wrote a letter to the Delhi government saying that we cannot give you the desired quantities because we've not been asked by the central government to provide those quantities to you. So domestic purchases, no state, not even a BJP state, has a free hand. Number two, as far as international purchases are concerned, international manufacturers have said to all states that we deal only with federal governments. Please ask your federal government to approach us and we will supply. Now, what the respective opposition parties and chief ministers have said, Rishika, is not that you give states the right to go and purchase overseas. We have only said that you give us the right to inoculate our citizens, but follow the national immunization program that was conducted in India a few decades ago, wherein it is one central agency of the government of India that purchases these vaccines in bulk numbers. Then these vaccines are distributed to states to inoculate its citizens, and within the state, the inoculation drive is conducted by the state government.
Right.
This is what the national immunization program was, and this is what the states have asked for. Number two, in countries like the United States, in countries like United Kingdom, they gave approvals to Pfizer, Moderna, etc. back in December. In Jan, they started inoculating their own citizens. We till date in May have not even given approval to these foreign manufacturers, despite these foreign manufacturers having approvals from 80 to 90 different countries across the globe. So I shudder to think the vaccination plight of this country. And Rishika, let me say this in conclusion, that the rate at which our country is progressing in vaccinating its citizens, it will probably take if I were to do a good number, at least 5 years for the government of India to inoculate its entire citizenry. Now, do we want waves after waves come and hit us and lose more precious lives? It is for the government of India to decide.
PKD Nambiar, I'll give you 2 quick minutes to respond to this. I'm completely out of time.
First and foremost, that there is no country in the world, or especially in India, we may be the vaccine capital of the world. I must correct Raghav that we have never done a universal immunization anywhere in the world, and this is the first time we will be doing it.
Mr. PKD Nambiar, quick question. Was it a mistake for us to have exported vaccines? Should we have used those doses to inoculate our own population?
This was clearly explained by the foreign minister of this country. There are 2 reasons. Today, you are manufacturing vaccines. Where is this raw material is coming from, Rishita? You tell me. Is it all manufactured in the Pune or anything?
No. So what are you saying? What are you saying?
Only one vaccine, that is the Covaxin, is the only vaccine which is indigenously developed. The second one, there are contractual obligations. This was clearly explained in number of times by the foreign minister. I don't know why the opposition parties are just making it as a story.
May I answer your question?
Again
so
and again.
Are you saying that we gave vaccines to other countries out of compulsion?
There are contractual obligations, there are diplomatic reasons, there are multiple reasons for this. This is not one reason.
Are those reasons bigger and more important than vaccinating our own population? That's the question.
In fact, Raghav said initially that we are a vaccine capital of the world. So we also have some kind of a responsibility towards the world.
What I say carries so much weight with Nambiar Saab. May I just say one last thing? Nambiar Saab, as far as exports are concerned, you know this and I know this, that crores and crores of vaccines were given to poor nations as gifts. We chose to gather global goodwill for the Prime Minister over inoculating our own citizens, and we should take example.
In hindsight, no, but Raghav, you made your point. Let me get PKD Nambiar to respond to that. In hindsight, do you believe that that was a mistake? We should have saved those doses for our own population, given what we've been through in the second wave.
Definitely no. This is where the mistake we are all making. Please look, I'll just explain you, Raghav. I'll tell you. You remember in the first time when we started inoculating the people, the vaccines, number of states, you please look at the records. I don't have it right now. Many states, that number of vaccines have even got damaged or they were not able to give. There is a time period for it. Secondly, there is a large number of logistical reasons. We are a large country. We are not a small country.
No, but if we had those surplus shots, we could have vaccinated the 18+ population earlier. Look at what young people have been through in the second wave of COVID.
My dear friend, we are
Anyway,
a 1.35 billion
Rishika,
people
is-
country. We are
Okay.
a large
Nambiar,
country.
PKD
We are the
Nambiar,
majority
lastly,
of
no,
the
I have to
population.
get you to respond to one more. I have to get you to respond to one more issue. And that issue is about this double speak on vaccine policy. One side, the centre says that we've given states a free hand and this is a liberalized vaccine policy. On the other hand, you know, there is a letter which we've accessed where the Delhi government's been given a quota. What explains this?
It's very simple. One is that, of course, the different states have asked for the right to purchase the vaccine for themselves, which the government has agreed. Yes, you may please go and buy it if you.
But the
if you
government will
can.
regulate how much?
Number two. Then there is the policy of vaccine policy, which Mr. V.K. Paul has clearly explained to everybody. It is depending upon the population of the state. Because please understand, if all the people in Delhi is vaccinated, does not mean that the other people in and around the Gurgaon or the Faridabad or in the Ghaziabad.
Rishika,
It all boils down to the fact that we don't have enough vaccines, which is why we are stumbling and fumbling over these policies. I'm afraid I'm completely out of time. Thank you both very much. This is a conversation we clearly will continue to have here on NDTV. Short break. We'll be back with more news. Stay with us.